Hi, everyone. Welcome back. My name is Dr. Samantha, and I am the maternity mentor. Welcome, welcome. Tonight we're here with another one of our live Q&A sessions that we do every Monday night at 9 p.m. Eastern Standard Time. And this is a chance for us to answer any of the questions you have live that you put in the chat, as well as answer any questions that you guys put on the videos this week. Remember, we're trying to put out videos every Tuesday, and please make sure you like and subscribe to the channel and hit the notification button so that you can get notified whenever we're putting out new content. We also have Facebook, Instagram, and Twitter for additional content, and we will link those links in the description below. Additionally, make sure you tell your friends and family, anybody you know who's pregnant or has just had a baby or has a toddler, because the channel focuses on pregnancy and postpartum topics. Remember, anybody who's joining us, please feel free to put questions in the chat. And if you're watching this after the live, remember that if you place any questions on our videos, we will try to get it answered during the next live Q&A session. All right, so we're going to go ahead and we're going to get started tonight. We have a lot of great questions. So the first question we have comes to us about antidepressants. So I am 10 weeks pregnant. I have OCD, anxiety, and depression. The medication was withdrawn. Can I resume, and what would be the best dose for me? My doctor says that 12.5 milligrams of sertraline. So this is a great question, and I really feel very passionately about depression and anxiety because I'm a psychiatric nurse practitioner. I used to be in labor and delivery and all that stuff. I did that for 13 years of my life, and then I moved into psychiatry so that I could help women who are pregnant or postpartum with medications. So let's talk about this. So sertraline is also known as Zoloft. It tends to be the go-to medication for anybody who's taking care of pregnant women or women who are breastfeeding, because this is the medication that's been used most widely, and it's extremely safe for use. So we cannot do any kind of medication test trials on pregnant women or women who are breastfeeding because it's not ethical. Because if the medication is harmful to the baby, that wouldn't be right. So as a result, all the data we get, it comes from doctors submitting stories about their patients. It comes from physicians and pharmacists looking at the medication composition, like is it fat soluble, is it water soluble, how big is the molecule, how long does it last in your body? And they take all of this together and they decide whether a medication is more safe or less safe. With any antidepressants or anti-anxiety medication, it's always risk versus benefit. Now, what you need to know about depression and anxiety is if it's left untreated, it can lead to miscarriage, preterm birth, stillbirth, low birth weight, and a variety of other complications. It also puts your baby at higher risk for mental health issues later on in their life. That's because anxiety and depression, when left untreated, is a very stressful situation for your body physiologically at the cellular level. So this causes your body to release a whole bunch of hormones that affect your circulation and how you use the nutrients and chemicals that are coming into your body. And that affects your baby because everything that happens to you happens to your baby while you're pregnant. So sertraline Zoloft is a medication that we commonly hear of as like an antidepressant. But these medications, this is in a category called SSRIs, which are medications that boost a neurotransmitter called serotonin. So serotonin is basically a chemical that when you don't have enough can lead to depression, anxiety, and other symptoms. Zoloft or sertraline helps boost that serotonin. So one of the things that you need to know is this whole category includes like Prozac, Lexapro, Paxil, Celexa. And I say this because some of you, depending on where you're tuning in, may hear different medications. So these medications are usually called antidepressants, but they're actually also anti-anxiety medications. And they actually, in my opinion, treat anxiety better. Now, in this question, the mom mentions that she has OCD, which is obsessive compulsive disorder. That's actually a form of anxiety. This is where somebody gets ruminating thoughts or thoughts that just keep going and going in their head. And then that's the obsession part. And then to get rid of that thought or make themselves feel better, they have an act that they need to do. That's the compulsion. So one of the most common examples that everybody thinks about is somebody who's constantly thinking about germs and getting sick. That's the obsession. The compulsion is washing their hands frequently and way too often. Zoloft happens to be one of the medications that's actually good for obsessive compulsive disorder, as well as anxiety, as well as depression. So this is actually a really good choice, whether you're pregnant or not. And again, like I said, Zoloft is very good and evidence-based for pregnant women. Now, the one thing I'm going to mention is that this medication, the dosing is 12.5 milligrams. I love this. So this is a very low dose. When we're talking about medicating a pregnant woman, we want to start with the lowest dose possible and then medicate you until you feel 100% better. So it's better for us to use enough medication to make you feel 100% better than, say, get you to 80% better. However, starting at the lowest dose is the right way to do this. And then they need to monitor you and your symptoms. One of the things you should know about antidepressant use during pregnancy is there is a risk, especially for SSRIs at the end of your pregnancy, that when you deliver, your baby could have withdrawal syndrome. Now, withdrawal syndrome sounds very, very scary, but it's really not as bad as it sounds. So withdrawal syndrome is where your baby gets very irritable after birth. That's because the little bits of Zoloft that they've been getting through the placenta are just gone. And so they can feel that. They have a drop in their serotonin and their body just needs to pick up production. So in the meantime, they may have a high-pitched cry. They may cry more. They may be irritable and want to be held a lot. They may want to eat a lot. Now, this withdrawal syndrome only lasts usually for up to 10 days or less. One of the ways you can help prevent it is to breastfeed because your breast milk and your colostrum is going to have little bits of Zoloft as well, which will help the baby kind of withdraw naturally. And then you just know you're going to have to hold your baby a lot, lots of skin to skin, and it's going to go away. So the questions were, can I resume and what would be the best dose for me? Again, you start low with the dose and you go up until you feel better. Can you resume? Absolutely. For those of you moms who are thinking about whether you should be taking your medication away before you get pregnant, you should speak with your healthcare provider and look at your whole history and your whole picture, because there are many medications that are safe to stay on while you get pregnant and while you stay pregnant. Okay, so that's a very, very, very good question. All right. Our next question is about bed rest. So I'm 21 weeks pregnant with a complete placenta previa. I had bleeding, which has since resolved. I was placed on complete bed rest. Does that mean no sitting and staying in bed all the time with the exception of trips to the bathroom? So this is a great question. So let's start with some terminology. Placenta previa. So you have the uterus, okay? And the placenta is the organ that feeds your baby and it attaches to the side of your uterus, okay? So this is full of blood. Now it's supposed to be kind of to the side. At the bottom of your uterus is your cervix, okay? This is the opening down to the vagina, which should be long, thick, and and closed. This is closed, right? So this is your uterus. Now your placenta should be up here, but sometimes the placenta ends up going over the cervix. Now the cervix closed is not 100% closed. It's 99.99% closed. There's a little tiny slit here because this has to open eventually for the baby's head to come out. When the placenta is over a closed cervix, everything is usually fine. However, occasionally you will see some spotting, which is why when you get bleeding, you need to tell your healthcare provider so they can check it out. But eventually, you're going to start to have contractions. And the idea of the contractions is they're supposed to help pull apart the cervix. This is their job because the cervix has to open. So as the contractions start to open this up, you can have bleeding, intense bleeding. And that bleeding, if left untreated, can be a medical emergency because you and baby can hemorrhage. So when we notice a complete placenta previa, the first thing you need to know is this is an automatic C-section. There is no pass and go. You are not going to be able to have a vaginal delivery, which is fine. C-sections are fantastic and you can still have a wonderful delivery. Now, the second thing is you need to know you're going to be having a premature baby. We no longer really allow women to go to full term. We try to deliver the baby before active contractions start. Because remember, when you have contractions, the idea is to pull that cervix apart to allow a head to come down. Only we have a placenta over the top. So usually birth, depending on where you are and your particular pregnancy, will happen between 32 and 36 weeks. The average is 34 weeks that with a complete placenta previa, you'll be having a cesarean section. In the meantime, we need to try to keep you pregnant. So a lot of times doctors will put you on complete bed rest. So the question is complete bed rest everything except trips to the bathroom? I'm going to say probably. Now, you should ask your healthcare provider to be absolutely sure because there are risks to complete bed rest. Complete bed rest puts you at risk for blood clots and it puts you at risk for pneumonia. Blood clots occur because your legs stay stationary and you're at higher risk for clotting due to some of the clotting factors that are naturally in your blood during pregnancy that help prevent you from bleeding if you were to deliver early. So if you're not moving around, a blood clot can happen. That's why they tell you to say walk around on an airplane or stop every couple hours to walk around if you're on a car trip. Now, pneumonia is because when we walk around, we expand our lungs, okay? And when we're just laying down, our lungs stay kind of contracted and we don't breathe deeply. And if you don't breathe deeply, you can't get yucky bacteria out, and that can lead to pneumonia. So it's very important for us to only use complete bed rest when absolutely necessary. But now remember what I said. We're trying to prevent contractions because contractions can lead to the cervix opening. And contractions can happen for a lot of different reasons. They can happen because you exert yourself too much, because you lift something too heavy, because you have a vagal maneuver, which I'll get back to, because you're dehydrated, because you're stressed out, all different types of things. So when we do complete bed rest, we have the highest likelihood of keeping your body from contracting. Because remember, you can still have Braxton Hicks contractions at 21 weeks. The other thing is that we can also potentially prevent your cervix from opening due to other factors like incompetent cervix due to pressure that's being applied to the cervix by the placenta and possibly by your baby that would just cause it to start to naturally open. Vagal maneuvers are maneuvers where basically what happens is like when you bend over, you create a lot of pressure inside your abdomen. That creates a vagal response, which actually can cause you to push it, like not on your own, not consciously, but subconsciously, your body pushes down on that uterus. This can also happen when you're constipated. It can happen when you're vomiting. So we want to try to prevent that so that you don't start contractions. Complete bed rest can assist with that. However, some doctors don't mean that. Some doctors might think complete bed rest is you can get up to make your own meals, you can get up to get your own drink, you can go to the bathroom, you can take a shower, and that's it. Some doctors think complete bed rest is you can't get up for anything and you should be using what's called a bedside commode, which is basically a bucket to pee and poop in. And other than that, you're laying in your bed, meaning no showers, nothing. So you need to ask your provider what they mean by it. Generally speaking, though, if they use the word complete bed rest, they mean for you to be doing nothing but staying either on a couch or a bed, lying down, only getting up to use the restroom, and possibly taking a 10-minute shower. Do not assume that you're allowed to take a shower without asking your healthcare provider first. Showers are actually commonly known for inducing labor, so you want to make sure you ask. So that's a very, very good question right there. For anybody who's joining us, feel free to put your questions in the chat if you have any, okay? All right, the next question is about bleeding. We get tons of questions about bleeding all the time. I'm 8 weeks pregnant, but no baby in scan. I had light brown clots in discharge. My doctor says beta HCG test only says nothing. So I am very sorry to hear this. So what's happened here is unfortunately is a miscarriage. So serum HCG levels are the hormones that we test in your blood to see if you're pregnant. When you're pregnant, these levels will be a certain number, and honestly, it depends on how far along you are. Once you are pregnant, those numbers should continue to rise. So sometimes we will check them more than once to make sure that they are rising at the normal rate. However, if a miscarriage is suspected, your doctor will often run that level, and then a couple days later, they will run it again. And if the level is 0, or if the level is decreasing and going down, that's a sign of a miscarriage. Additionally, with no baby on the ultrasound being seen and no HCG levels, there's most likely that this was a miscarriage. The light brown that you see, those clots, may just simply be a little bit of the leftover remnants of what was starting to be a placenta, and they're just coming out. You want to keep an eye on this, and if your bleeding gets worse, you want to let your healthcare provider know. All right, our next question is about carpal tunnel syndrome. So I'm 39 weeks pregnant and experiencing carpal tunnel syndrome. For the past 2 weeks, I have been feeling my thumb, index, and middle finger not working well, and they are weak. At night, I have a pain in the wrist. I was wondering if it will disappear after delivery. I'm so worried. Is it okay to use these fingers in spite of uncomfortable feeling because it is my dominant hand? So this is a great question, and I'm really happy to hear. I like to hear the carpal tunnel syndrome questions because it's so common in pregnancy. So the nice thing is for this mom, she's 39 weeks pregnant, which means she's very close to the end of her pregnancy if she hasn't already delivered. And so she'll be able to start to seek better treatments almost right away. Carpal tunnel syndrome is where the carpal space of your wrist, this is the space where all your nerves that come into your hand is. And this space basically gets kind of compressed. It gets kind of squeezed, okay? Now, this can happen because of swelling. It can happen because of fluid. It can happen for a variety of reasons. And when that happens, it affects the nerves, which causes nerve pain and sometimes like numbness and tingling in the hand. Also weakness, as this mom is experiencing. Carpal tunnel syndrome can be treated through a couple different methods. One of the things that can happen is you can go ahead and you can get a brace. Now, you can't just buy a brace over the counter. You need to see a hand specialist who can examine the hand and tell you what kind of brace to use, because certain braces can actually put more pressure onto the carpal tunnel space. You also want to make sure that you're doing things ergonomically. So what that means is you're doing like your work, like your computer work, in proper position. You don't want to bend your hands like this. This actually is no good, and it compresses that space. So when you're typing, you want your hand to be able to be straight like this. Additionally, they sell a lot of these pads. They're soft pads that you can actually lay your wrist on, which can also help. For those moms who are starting to experience carpal tunnel syndrome earlier in your pregnancy, I still recommend you get to a hand specialist for carpal tunnel syndrome. So the thing is, some of this stuff can be treated while you're pregnant. For example, the brace for your wrist. Another example, which this mom kind of alludes to, is that her hand is starting to get weak. When your hand weakens due to carpal tunnel syndrome, one of the things you can do is you can actually go and get occupational therapy. So, occupational therapy is kind of like physical therapy, but for your hands. These are therapists who specialize in the functionality and strength of your hands. So, while you're pregnant, occupational therapy is a great treatment because it doesn't involve any medication. You can learn different techniques, including stretching and strengthening, to help improve your pain while you're waiting to deliver. Unfortunately, with carpal tunnel syndrome, they're not going to want to medicate you unless it's absolutely necessary. They're probably going to limit you to the Tylenol, which you can take safely during pregnancy, and they're going to recommend a lot of ice. Some people recommend heat, but ice is better for pain. And they're going to ask you to try to get through until you deliver. Now, depending on what's causing your carpal tunnel syndrome, it may resolve after birth. If you have a lot of extra fluid in your body because you are pregnant, and most women do, a lot of that fluid starts to come out the second you give birth. And when that fluid disappears, the swelling in this area disappears and the carpal tunnel syndrome goes away. Additionally, if you were to figure out that some of it was like your positioning of your hand and stuff like that, it could also be that fixing those things, it could cause it to go away right away. There are some women who deliver, and the day they deliver, the carpal tunnel is gone. However, some women, it does not. For those women, if you've already seen your hand specialist, then you're established with that doctor. You already know your options for post-delivery, and you can be ready to get treatment like right away if you want to. Treatment can include surgery. The surgery is usually pretty quick, and then it actually has a lot of relief and you can get back to normal fast. And for those of you who are concerned, well, what if I decide to get the surgery and I'm breastfeeding? There's a lot of medications that are safe for breastfeeding, but you can also pump a little bit of extra milk ahead of time and just pump and dump during the surgery time, and you should be good. Now, you want to make sure that you go ahead and you speak with your healthcare provider about like what options you've been given and whether they're on board with you doing it. For this mom who's 39 weeks and may not have seen a hand specialist, fair, just find a hand specialist. You can call them as soon as you deliver. But this is a great question. So for any of you who are joining us, please feel free to put your questions into the chat box. That's what we're here for. The live Q&A session that we do every Monday at 9 p.m. Eastern Standard. So our next question is about morning sickness. So I'm pregnant with my second baby and the second time with HG. Currently 27 weeks and 5 days and running out of med options. My next and possibly last option is the Zofran pump. I find peppermint helps me with the mild nausea that meds don't take away completely. Unfortunately, I've developed PTSD. Every time I gag or vomit, I have a panic attack. I am so sorry to hear this from this mama, and I know how traumatizing HG can be. So for those of you who don't know what HG is, it's hyperemesis gravidarum, which is extremely severe form of morning sickness. So I actually had HG with both of my pregnancies, and I can tell you for years afterwards, I had a lot of trauma with eating spaghetti, because it just reminded me of a lot of very rough times. So there are very limited options for women who are suffering from hyperemesis gravidarum. And developing PTSD is actually a very real thing. What I want to tell you, if you're listening, is I want you to go on to Postpartum Support International, and we will link their website in the chat box. They have a lot of online support groups that you may be able to join, including support groups related to PTSD. It is extremely common for women to develop this. Now, what can we do? So Zofran pumps Zofran is a medication that's commonly used during pregnancy to help with hyperemesis. It's used, a pump, what they mean by that is it's a liquid medication, and they go ahead and they insert a little tiny needle under the skin, and then the medication kind of continuously delivers the Zofran to help prevent nausea and vomiting. For some women it works, for some women it doesn't, and unfortunately it can be expensive, and not all insurance companies will approve this treatment. So what are women to do? One of the things I try to tell women is, if Zofran is an option, have they given you the 4 milligram dissolvable tablets and allowed you to take them more frequently? A lot of women are given 8 milligram tablets, sometimes the swallows and not the dissolvable ones, and told to take them 3 times a day. I find that to be too far in between, and it doesn't really seem to work. So the 4 milligram dissolvable tablets that you can take more frequently often work better. Now, the next thing is you take the Zofran around the clock. You don't take it as needed. So that's another big thing. If you have severe morning sickness, you can't wait to take something until you're nauseous, because then it's a vicious cycle. Once it starts, it doesn't stop. I actually went into premature labor when I was 32 weeks pregnant with my second child from vomiting 8 times in one day. And I had to go to the hospital and get magnesium to stop my labor. I ended up vomiting the same day I gave birth from that same pregnancy. So I really do get it, which is why it's important to prevent throwing up before it starts. Now, what can you do? She mentions peppermint. Peppermint is great. A lot of people respond very well to peppermint. Ginger is another common one that I've seen used. Some women like it, some women don't. I'm going to tell you, if you haven't tried all the different versions of ginger, make sure you try them all. So some people kind of like the artificial ginger, like literally the kind of ginger powder. Some people do fresh ginger root and they just chew a little bit of it. Some people like the ginger lollipop. Some people like ginger tea. And of course, there's ginger ale, which is a soda. And I'm going to tell you, for some people who say ginger ale doesn't work, you should try warm ginger ale as well, because for some reason, some people don't respond to regular ginger ale, but they do. The warm ginger ale helps. Another common thing you can do is C-bands, which are these bands that utilize this pressure point on your wrist that when it is pushed in just right, it will help relieve morning sickness. The other thing we use is something called diclegis. So diclegis is a medication that is prescribed by your healthcare provider. It is extremely effective for hyperemesis gravidarum, except most insurance companies will not cover it, and it's very expensive. But the brilliant thing is, diclegis is simply 2 over-the-counter medications put together. It's Unisom and vitamin B6. And when you put these 2 things together, you make diclegis. So you can ask your healthcare provider about whether it's safe for you to take these 2 medications. You would take them at night because they do cause you to be a little sleepy. But that's not necessarily a bad thing, because you might be able to sleep a little bit better. Now, if you have tons of throwing up, you're at risk for dehydration and loss of electrolytes, both of which can cause preterm birth. So you want to make sure that you're drinking lots of fluids and you're drinking something like Gatorade or something to replace your electrolytes. So the other thing that I want to say about this is that it's important to start dealing with those panic attacks, now. That anxiety, that probably apprehension about never knowing when you're going to throw up again, this can cause a lot of different changes to your behavior, even subconsciously. For example, a lot of moms that are afraid to throw up, they stop eating. They don't even realize it. They just know that eating is associated with throwing up. And so their body just doesn't crave food. You avoid food. You don't eat as much as you should. And so one of the most evidence-based treatments for anxiety and PTSD is therapy. I think therapy is a wonderful, wonderful tool for all of us to have. But when you're experiencing such extreme anxiety, you want to start talking to somebody about it. Start learning some different coping mechanisms and skills that you can utilize to avoid these panic attacks. The nice thing about Postpartum Support International, their website is linked into the description, is they also have a list of providers who've received specialized training in helping women who are pregnant or postpartum. So you can actually look on their website for providers in your area that will be able to help provide you with therapy. And finally, the other thing I would tell you to do is the more you can get the best nutrition and the best hydration, the better you're going to feel. And actually, in a lot of cases, it will decrease your nausea and vomiting. So one of the things you can't do is you can't have these big giant meals, because every time your stomach it gets too full, it will induce that vomiting. So a lot of women end up getting constipated, or their GI tract slows way, way down during pregnancy because they get this big belly and a baby pressing on all of that. So you have to eat smaller amounts. Now, when I had my hyperemesis, one of the things I would do is I would take a sip or a bite, and I would remember laying down and just saying, I just got to keep it in for 10 minutes. I just got to keep it in for 10 minutes. And sometimes that's what you got to do. One bite at a time, hold it down. If it takes you 4 hours to eat your dinner, then it takes you 4 hours to eat your dinner. Okay. But these are really some of the best things that you can do for this. And I'm really hoping that you'll start to feel better soon. Welcome, welcome for those of you who are joining us. I am Dr. Samantha, the maternity mentor, and we're here for another one of our live Q&A sessions that we're trying to do every Monday at 9 p.m. Eastern Standard Time. So please feel free, if you have any questions that you want to ask, please put them into the chat and we'll try to get to them live. Let's answer another question that we have about paced bottle feeding. So I had a viewer question whether paced bottle feeding was actually the right type of feeding for a baby. And their comment was related to the baby getting too much air. And one of the other viewers said, this is how many major medical and healthcare organizations around the world say a bottle should be fed. UNICEF, HSE, NHS, even CDC says to hold the bottle at such an angle that milk doesn't freely drip out. For the majority of bottles, this means almost completely horizontal. So that information is correct. And I loved the comment, which is why I wanted to address this. So you have a baby and you go to bottle feed. Okay, this is our bottle, this is our baby. So we're used to doing this. Okay. And when we position a bottle like this, the milk just pours out of it. So the reason why babies who are bottle fed tend to get, frankly, fatter quicker than a breastfed baby is because they overeat. This also probably explains why bottle fed babies, whether breast or formula, tend to have more colic than a direct breastfed baby, because they're just chomping down and it's just coming out so quick. Now, this is also why if you bottle feed too quickly, a baby may not want to breastfeed, because breast milk doesn't come out. It doesn't just pour out. You have to suck to get it out. Okay. So in order to properly bottle feed a baby, you want to do what's called paced bottle feeding. So with paced bottle feeding, you're allowing the baby a chance in between to slow down their feeding. Additionally, when the stomach is given enough time to expand and register itself being full, it sends a signal to the brain saying, brain, I'm full. I don't need to eat anymore. The brain sends down a chemical that tells your body you're not hungry, and baby stops eating. This helps to prevent obesity. This is why they tell us adults, if you want to lose weight, don't rush your meals, because if you eat slower and pay attention, you'll actually get the signals that you're full faster. Back to paced bottle feeding. Paced bottle feeding looks like this. If you put a nipple like this, it'll be completely full of milk. If you put the bottle like this, it's half and half. Half milk, half air. If you put the bottle like this is all air. Now, what you do is you put the bottle into the baby's mouth like this, and the baby starts to suck. What this is doing is this is teaching baby that milk doesn't just come and you have to work for it. Now, after a couple sucks, you turn the bottle like this so that when baby's sucking, baby is getting milk. Baby is also getting a little bit of air. And I think this is where the other viewer was concerned. Most of that air comes back out the side of the mouth. It never gets swallowed. What little bit of air gets swallowed is practically the same as feeding a baby like this, where they're gulping, right? So, and the only thing you do is just make sure you burp them well. These babies do not swallow all that air that you see in that bottle. And what happens is they actually will not overfeed, which is what causes the vomiting, not the air they're taking in. So this promotes breastfeeding because it slows a baby down, allowing them to understand that wherever they're latching onto, they need to suck to work to get out the milk. And of course, again, it prevents obesity by learning when you feel full. Babies are mini human beings, mini adults. They do this, a lot of the same things we do, and they need to learn to not overeat just like us. And so what the other viewer said about all those agencies endorsing this type of bottle feeding is correct. Paced bottle feeding is the best way to feed a baby. Okay, our next question is about sexually transmitted diseases. Hi, if a female has genital warts, about 30% remaining in her 38th week of pregnancy, can she go for normal delivery? What do you suggest, C-section or is a normal delivery okay? So this is a great question. So to be clear, because sometimes we get confused with terminology, genital warts is the proper term. However, another sexually transmitted disease is genital herpes. So since these both start with the same word, we need to make sure we're clear. Genital herpes with an active herpes outbreak is an automatic C-section. Automatic. So if you know you're having an outbreak, do not hide that from the providers. Providers will look for lesions, but if you have a very small lesion, or if you have that feeling because you've had outbreaks before that you kind of know it's coming on, you need to let them know. If a baby is exposed to genital herpes, active herpes, they can die. Plain and simple. Most of them will develop the herpes infection without any symptoms. Many of them will go home. Some of the first signs of a herpes infection in a baby look very benign. It's not a big deal. They look like it's not a big deal. For example, it will be a baby who doesn't eat very well and a baby who sleeps a lot. Well, what are we always told? Newborns sleep a lot. If you're not sure how much is the right amount to feed a baby, you might not realize they're not eating enough. And by the time it's noticed, it could be too late. So again, genital herpes is an automatic C-section. Do not hide these symptoms from your provider. You want to make sure they know. Now, genital warts are actual growths. So herpes are like sores. Warts are little growths. Everybody's warts can look a little bit different. Genital warts does not mean that it's an automatic C-section. You have to ask your provider. It depends on a whole bunch of different circumstances, but most babies will not acquire the virus that causes genital warts, which is HPV, during delivery. For the few babies who will develop HPV, like they'll get it from their mom, they will usually clear it out of their system and never have any symptoms whatsoever. The bigger risk with genital warts in a vaginal delivery is that they could actually bleed. They could actually tear open and bleed, and that can cause some other complications and put you at risk for infection. So what I would tell you is it's not an automatic C-section by any means, but you need to have an active discussion with your healthcare provider to determine what's the best way for you to deliver. All right, our next question is about vaginal discharge. So my discharge is white and watery, but I am supposed to ovulate yesterday and I didn't. I have this breast lump and my abdomen hurts. What does this mean? So the short answer is, of course, I don't know. Short answer, solution, take a pregnancy test. I mean, one of the things you want to do is if you have any symptoms that you might be pregnant, and some of those symptoms can include discharge, they can include breast pain, they can include sometimes a little bit of abdominal discomfort, you take a pregnancy test. You go to the store, you buy a home pregnancy test. Now, with any type of vaginal discharge, you want to get it checked out by your healthcare provider, especially if you're pregnant, because all sorts of vaginal infections can lead to miscarriage and preterm birth. So, what your provider is going to do is they're going to take this sterile swab. It's like a long wooden stick with a little cotton tip applicator, and it's sterile, which means there's nothing on it. It's open up, it's very clean. And they're going to swab some of that discharge and they're going to send it to a lab to test it and see what it is. There is some normal amount of discharge during pregnancy. This is discharge to help protect the vagina from infection, and it's very, very normal. But you don't want to just assume that the discharge you're having is normal. You want to ask. Now, some obvious signs that a discharge is not normal. If your discharge is pink or red or brown, that's usually a sign of bleeding. If your discharge is chunky and white, that's usually yeast. If your discharge is green or yellow or frothy or watery, that is also a sign of an issue. And of course, if there's any kind of smell, you want to make sure that you get it checked out. So don't just assume. Now, in this mama's case, I would just tell you that it's possible that you are pregnant and you want to take a pregnancy test. So it looks like we've got a question in the chat. So thank you so much. I never had hemorrhoids before pregnancy. Will the hemorrhoids be gone after birth? I have not been treated. So that's a great question. Hemorrhoids are very common during pregnancy. So they happen for a couple of different reasons. Hemorrhoids can happen and most commonly happen to most people because of straining. So hemorrhoids are basically enlarged blood vessels inside the rectum and on the outside around the anus where you go to the bathroom, number 2, where you have a bowel movement. And when you're constipated, what happens is you're basically the stool is hard and you haven't gone in such a long time that you have a lot of it. And you kind of have to push really hard to get it out. And when you push, that causes those blood vessels to get bigger. And sometimes they actually start to stick out and then they just stay like that. They've been stretched out too far. So hemorrhoids are common during pregnancy. And once you have a hemorrhoid, they pretty much don't go away. Now, sometimes they will be larger while you're pregnant or while you're delivering. And then after birth, they'll start to shrink again. And there are some hemorrhoid medications that you can take that will help shrink the tissue and make the hemorrhoid smaller. But they really, really, really don't go away, unfortunately. You want to ask your healthcare provider what you can use during the pregnancy because keeping them smaller is better. Usually Tux pads are often recommended. Tux pads are these cotton pads that are infused with something called witch hazel. And witch hazel, when applied, so you just lay this on top, helps to shrink down that tissue and it also helps with pain, which is really, really nice. So, unfortunately, they're probably going to be there. Now, I see a couple of you joining us. I'm Samantha, Dr. Samantha, the maternity mentor. Please feel free to put any questions that you have into the chat. And we'll go ahead and get them answered for you. So I'm 1 month pregnant and my husband and I had sex and took a walk outside for about 2 hours. Now I'm in bed and I saw blood. Should I be worried? So one of the things I'm going to tell you is that you don't necessarily need to be worried if you've had sex and taken a walk and then you see some very mild spotting. So the hormones that allow you to have a healthy pregnancy, those hormones are kind of bad for the vagina in the respect that they thin the tissue out and they kind of make it drier. So that makes it easier to tear, especially during something like sex. And when those tears happen, you have a little bit of bleeding that can occur. So should you be worried? Probably not. But what do you do about it? Every time you see bleeding, that includes pink, brown, red, you need to contact your healthcare provider. You want to let them know what's going on so they can assess you. That means to check you and determine what the problem is. Because there's other things that could be occurring, such as a subchorionic hemorrhage, and we have a video on that we can link in the description. And these things can actually require certain types of treatment. But in this case, it's probably not a big deal. All right, I have another question that is asked very commonly of me, and I'm going to bring it up because I had a comment on one of my videos. So a lot of moms ask, is colostrum enough to feed my baby in the first 3 days? Okay, so you will hear mom time and time again say that their baby seems like it's starving in the first couple days, which is oftentimes where they reach for formula in the hospital because they're so worried about the baby because the baby is crying so much. So, first day of life, baby's tummy is teeny tiny. And when they start to practice breastfeeding, which is really what they're doing, they're practicing, they'll get out teeny tiny bits of colostrum. But they don't really get a lot of colostrum, and they don't really need a lot of colostrum. Most healthy full-term babies will have enough stores in their body of, sugar and fat and protein that they don't really need to eat. So the first 24 hours is practice because babies don't actually know how to breastfeed. I know they say that they do. They don't. It's a skill. They need to learn the skill. So after 24 hours, what happens next is your baby's stomach has naturally gotten a little bit bigger, just a little bit. But now they're waking up and those stores are gone. So now they start to feel hunger. But your colostrum has not really changed in volume. Maybe got a little tiny bit bigger, but it's really the same amount, which means unlike the first day where they felt full, now they feel hungry. So what does a hungry human being look like? Cranky and irritable. In the case of a newborn who can't do anything but cry, they cry. So you'll feed and then you put them down and 30 minutes later, they want to cry. You'll feed, 30 minutes later, they cry and they need to eat again. And it's this constant cycle, right? What is that doing? While it seems like your baby is starving, what it's causing is your baby to demand. The more you put the baby on the breast, the more your body gets a signal to make milk. And the more milk you make, the better it is for your baby. It's a cycle that will fix itself. Now, what I am going to say is if your instinct tells you that you need to feed your baby more than your breast milk, do it. I am not anti-formula, and I feel very strongly that you should not feel bullied into one type of feeding or another. But if your baby is peeing and pooping the normal amounts, and your baby is just simply asking for a lot, this is considered normal. And if you pursue it, it will allow you to build a very robust milk supply. So, hi, Brenda, welcome. I see your question. So, is bleeding after sex okay while pregnant? So, it can be, okay? Going back to this, it definitely can be because those tissues are very fragile due to the hormones that sustain your pregnancy. So a lot of people think, oh my God, it's not, you should never see blood, but we actually see blood a lot during pregnancy. But the trick is if you see blood, you do still need to contact your healthcare provider. They're there 24 hours a day, 7 days a week, or they have somebody covering for them. This is what they signed up for. No question is stupid because if that bleeding is being caused by something else, then you need to make sure that you're getting that taken care of. Now, if you're bleeding a lot during sex, here's a couple things to think about. Why? So number one, use lots of lubrication. The same hormones that thin out the tissue also make you drier. And if you're very dry during sex, that will lead to more likelihood of tears. And those tears are what causes the bleeding. So use tons and tons of lubrication. The lubes that we use during sex are safe for your baby. Number two, you want to think about what position are you in? believe it or not, position can influence whether you're going to get tears during sex. So sometimes it's angle. It's the angle of the penis that's going in the vagina or the toy that's going in the vagina. So if you think and you're like, oh my gosh, every time I have sex this way, I bleed, well, maybe try a different way, especially if you also think, oh, but if I have sex in this position, I don't bleed. I would try that as well. Okay. And then the other thing is, very honestly, you want to make sure you know where the blood is coming from. So we talked about hemorrhoids earlier. It's very common during pregnancy for women to get hemorrhoids. Well, if you have external hemorrhoids, which again are those swollen vessels, and you're having sex, it's possible that one of the hemorrhoids gets rubbed against and it actually is what's bleeding and not the vagina. So you always want to make sure, where is the blood coming from? But no matter what, you want to go ahead and you want to call your healthcare provider and let them check you out and make sure everything is okay. That was a great question. Thank you so much. I see. That's okay. Even though you're not bleeding a lot, you will still want to make sure that you get it checked out. We're going to link our subchorionic hemorrhage video in the description. So while you may think it is the sex, it could be other things. And one of those could be a subchorionic hemorrhage, which is a little tiny bleed kind of underneath the placenta. Those can also cause like a little bit of spotting, and sometimes they will occur during sex if you have an orgasm. Because when you have an orgasm, it does cause the uterus to kind of contract a little bit, which can irritate stuff inside. And probably it's nothing. It is probably nothing, but you never want to take a chance. You always want to let your healthcare provider know what's going on. Okay? That's a very, very good question. Okay? So for any of you who are joining us, we're kind of getting towards the end of our Q&A session, but I want to make sure that if you guys have any questions, please put them in the chat. That's what we're here for. We want to make sure we get to all of your questions. For those of you who are seeing us after the fact, because we do like to post these videos so you can go back and look at them. We are answering questions live every Monday at 9 p.m. Eastern Standard Time for anybody who's live on the video with us, or for those who have left questions on our videos. So please make sure to like and subscribe to the channel, hit the notification button. You'll get notified when one of our latest videos is coming out. We have a new video coming out tomorrow, which I think you guys are going to really enjoy. And we'll go ahead, and if you have any questions on any of the videos, leave it in a comment on the video, and we will be answering those on Monday nights. So I see what you're saying, Brenda. So this is common. This is common that doctors will say this, and then husbands won't believe or partners won't believe. And it can be because they don't understand kind of the mechanism of what's going on. My suggestion is that you bring him with you and have him listen to the doctor tell you, because sometimes women don't feel like having sex during pregnancy. And it's kind of out there in the media and popular culture that women won't feel like this for a variety of reasons. And so some partners feel like women may use pregnancy as an excuse, and some women do. I'm not going to lie about that. So he may be thinking that you're not telling the truth, which I know sounds not that great, but you're saying it. So I would tell you to bring him with you. If he doesn't want to come with you, I would ask your doctor to explain to you why you shouldn't be having sex and ask if you can record it. Your doctor will probably say no to that, but some will say yes. But if your doctor won't let you record the explanation that you can play to your husband, ask your doctor for a prescription. Ask them to write on a prescription pad, no sex per doctor because of bleeding. And you can hand that to your husband. That should be enough for them to realize that this is not something you're making up. The other thing is that very frankly and honestly, there's lots of different ways to have sex. So you should also ask your doctor what you're allowed to do. So sometimes no sex means no vaginal intercourse. If anal sex is something that you practice, that's something you could consider if your doctor allows it. You may also be able to consider something more external. And so you want to just ask what your options are. But if your doctor is saying no sex, you are putting your pregnancy at risk if you continue to have sex. Okay. For those of you who are left, I'm Samantha, the maternity mentor. I really appreciate all of you coming to join us tonight. I'm going to close it out here. Remember to follow us on Facebook, Instagram, and Twitter. Like and subscribe to the channel. Share it with your friends and family. I really hope you guys have a wonderful evening. Thank you so much for joining us. Bye now from the Maternity Mentor.